Alright, I'm Shantae. I'll be doing my head to toe assessment today. Hello, my name is Shantae. I'm an SVSU nursing student. I'll be doing your head to toe assessment on you today. Is that okay?
Yes.
Perfect. I'm washing my hands and I close the door for privacy. Can you please state your name and date of birth?
Emily Stadler, 9/14/04.
Perfect. And what year is it?
2025.
Perfect. And what city are we in?
Saginaw.
Perfect. You are alert and oriented ×3. I'm now going to move on to health history questions. Do you have any allergies?
I have seasonal allergies.
Okay, seasonal allergies you said?
Yes.
Okay. And what happens when you have seasonal allergies?
Just like congestion and sneezing.
Okay. And are you currently on any medications?
I take Zyrtec.
For your allergies every day?
Yeah.
Perfect. And no issues or complications?
Nope.
Okay. And do you take any herbs, supplements, or any other over-the-counter meds?
I take calcium.
Okay, no issues with that? No. Okay, have you had any previous surgeries?
I had my wisdom tooth removed about 3 years ago.
Okay, and no issues?
Nope.
Okay. What about any past or current medical diagnoses?
No.
Any family history?
My parents both have hypertension, and then my dad has AFib.
Okay, and do you ever feel like your heart's racing or any palpitations or anything? And do you check your blood pressure daily at home?
Yes.
Okay, and it's normal within normal range?
Yeah.
And you get that checked at the doctor and everything's normal? Perfect. And what about exercise? Do you exercise at all?
Yeah, I exercise every day for at least 30 minutes.
Perfect. And what do you do?
Cardio.
Perfect. And what's your diet like?
I try to eat at least 3 healthy or balanced meals a day.
Perfect. And then you get your vegetables, your protein, and everything like that?
Mm-hmm.
Perfect. Do you feel like you can improve on your diet?
Probably a little bit. Yeah.
Okay. Do you smoke tobacco, marijuana, cigarettes, or anything?
No.
And do you drink alcohol at all?
No.
Okay. And any recreational drugs that you do?
No.
Perfect. Is there anything that you feel or think I should know for continuing on this assessment?
No.
Perfect. We're going to move on to vitals. Are you okay to check it on this hand?
Yes.
This arm. Does that feel okay?
Yeah.
Check out my diaphragm. Alrighty. A little tight squeeze. You feeling okay?
Yeah.
Okay. Okay, I got 122/78. That is within normal range. Normal is about 120/80. Alright, then I'm going to check radial pulse for 1 minute. Okay, I got 81 beats per minute. That's pretty good. It's within normal range of 60 to 100. I'm just going to check one more time for 1 minute. For respirations, I got 12, which is a little bit on the lower side, but you don't feel a short of breath or feel like you can't breathe at all or anything, and you feel okay continuing on this assessment. Okay. All right, I don't have a pulse oximetry with me, but you don't feel short of breath or anything. Your color's good. You don't look blue in any aspects in your hands. I'll look at your feet here in a little bit once you lay down, but your face, colors, everything's good. So I'm going to take a peek at your hands. I'm going to look for clubbing. No clubbing noted. Cap refill comes back within 3 seconds on each hand, so I'm not concerned there. So I would assume that your action is about 95 to 100%. Okay. And then for your temperature, I don't have a thermometer with me, but you don't feel like you get chills or anything. Any fevers frequently or recently? Okay. And like I said, you don't look flushed. Your color's good, so I'm not concerned there. I'm going to feel your head. You're not too warm, so I'm going to assume about your temperature is about 98.6. Okay. Do you have any pain currently anywhere? Okay, perfect. All right, so now we are ready to continue on with this assessment. All right, so I'm going to start with your arms here. I'm going to go ahead and lift this up here. I'm just going to inspect your arms to see a bit of freckles. I don't see any lesions though or anything. Are these normal for you?
Yeah.
Perfect. I'm going to check your muscle tone. Your muscle tone is good and symmetrical on each side. Go ahead and flip your hands over for me. I'm going to check symmetrical radial pulses. Strong and symmetrical, and I'm going to check your brachial pulses. Perfect, strong and symmetrical, so I'm not concerned there. Do you have any issues with range of motion or anything? Have you broken any bones? Have you played any sports?
I played soccer, yeah.
Okay, and any injuries or complications or anything with that? Perfect. Go ahead and flex and extend your arms. Do you know how to swim?
Yes.
Go ahead and rotate your right arm for me. Any pain or discomfort?
No.
All right, do the on this side. Any pain or discomfort?
No.
A little bit of cracking, but all's good for you as well?
Yeah.
Okay. I do flex and extend. I don't remember if I did the shoulders up for cranial nerve 11. I'm going to push my hands down. Go ahead and resist me. Any pain or discomfort with that? Okay. Go ahead and rotate your wrist for me and do it the other way. Any pain or discomfort with that? Okay. Oh, I'm going to check your strength. Go ahead and squeeze my hands and push up and push down and push out and push in. Any pain or discomfort? Perfect. All right, we're going to move to your head. Go ahead and take your hair out for me. Did you get your hair dyed at all?
No.
Okay. Your hair is long and beautiful, looks very healthy, and no issues with dye. You said you don't dye your hair. So I'm now going to palpate your head. Just let me know if you feel any tenderness or anything. Just going to inspect your hair. I don't see anything concerning, so I am okay continuing on this assessment. Go ahead and put your hair up for me. I'm going to check for lymph nodes as well. And you don't get any headaches or had any concussions before or any concerns with your head? Okay. Let me feel for, go ahead and turn towards me a little bit, or this, yep. I'm going to feel for your occipital lymph node, which is right down here at the base of the neck. Go ahead and look straight for me, and no pain or discomfort with that. Perfect. Preauriculars, right here, postauricular, any pain or discomfort with that. Submandibular and submental, any pain or discomfort. Your cervical chain, and then go ahead and bring your shoulders towards me. Supraclavicular, no pain or discomfort with any of those. Check tissue turgor on each side, and you are not dehydrated. Okay. All right. So now I'm going to move to your eyes. Do you wear any contacts or glasses or anything?
No.
How often do you go to the eye doctor to get an eye exam?
Pretty much every year.
Okay, perfect. And you don't feel like you have any blurred visions or see any lights or flashing, anything like that? Perfect. And you feel like you can see okay, no concerns.
Mm-hmm.
Are you sensitive to light at all?
No.
Okay, perfect. So I'm going to check and see if your eyes are, if your pupils are reactive to light, they dilate and constrict. I'll check 6 coronal fields of gaze, all the jazz. I'm also going to inspect your eyes first and check for any drainage, redness, itchiness, or anything like that. I don't see anything. I don't see dryness, redness, dryness, or anything like that. Have you noticed any of those symptoms?
No.
Perfect. Are you sensitive to light? Sorry, I don't know.
No.
Okay. All right. I'm going to look in your eyes. Right here. Dilate and constrict. Dilate and constrict. Perfect. They dilate and constrict. I'm now going to check. I'm going to put this light at the brim of your nose and make sure the light hits your eyes equal. Oh, there we go. All right. It hits your eyes equally. Perfect. Go ahead and keep your eyes facing me. Look at my pen light and don't move your head. Check the 6 coronal fields of gaze. And then I'm going to check for accommodation, look at my pen light, and then look at my hand. Look at my pen light and look at my hand. Perfect. And then I want you to touch your nose and touch my pen light and touch your nose and touch my pen light and touch your nose and touch my pen light. Perfect. Alright, I'm not concerned with that. You get your eyes checked frequently. You don't have any issues with blurred vision or anything like that. So I'm not going to whip out the Snellen chart, which is cranial nerve 2. And you can see okay, and I'm not concerned with anything like that. Okay?
Okay.
Moving down to your nose, have you had any obstruction or surgical procedures or bleeding in your nose?
No.
Ever feel like you can't breathe through your nose? What about any sinus infections? You get those frequently?
No.
Perfect. I am going to look inside your nose. I'm going to take a peek at your mucous membranes, make sure they're light pink and moist. I'll take a look to see if any polyps are noted, and then I'll look at your symptom to make sure it's not deviated. Okay, are you okay that I do that?
Yes.
Okay. I'm going to take a look in your nose. Mucous membranes are moist and light pink. I'm not concerned. No polyps noted, and your symptoms not deviated, so I'm not concerned there. Alright, go ahead and hold one nostril and breathe in and out. Hold the other nostril and breathe in and out. Do you have any allergies or sensitivities to smell?
No.
Perfect. Go ahead and close your eyes. I want you to smell the scent for me and let me know what you smell.
Okay.
Perfect. Alright, now moving down to your mouth. Have you had braces before?
Yes.
Okay. And do you wear your retainers?
Yes.
Alright, any complications with that?
Nope.
Okay, and do you have any gums that are bleeding, cracked tooth, loose teeth?
Nope.
Do you still have your tonsils? Okay, I'll take a peek at that. I will be checking, I will suppress your tongue, and I'll check your uvula to make sure that rises inflammation. Okay, and I'll check your soft and hard palate, gums, teeth, and all that. Is it okay that I do that?
Yeah.
Go ahead and open your mouth for me. Soft and hard palate are good, teeth are good, gums are good. Perfect. I'm going to suppress your tongue. Go ahead and say ah for me. Perfect. I see your tonsils, mucous membranes are light pink and moist, and your uvula rises inflammation, so I'm not concerned there. Go ahead and stick your tongue out, move it side to side. Perfect. And do you know how to swallow? You
Yes.
swallow okay? Go ahead and swallow for me. Perfect. Go ahead and lift your chin up for me. I'm just going to palpate very lightly. Your trachea is in line, so I'm not concerned there. Alright, so I check cranial nerves 9, 10, and 12 with that. Go ahead and bite down for me and open your mouth. Bite down and open your mouth. Perfect. I'm going to check sensation. Go ahead and close your eyes and let me know where you feel.
Forehead, right cheek, nose, chin, left cheek.
Perfect. So I'm not concerned with that, so that's cranial nerve 5, and then I'm going to check cranial nerve 7, your facial expressions. Go ahead and smile and frown, puff your cheeks out, and raise your eyebrows. Perfect. Your face is symmetrical. I'm not concerned for any stroke-like symptoms or anything like that, okay? Alright, so now I'm going to move to your ears. Do you have any ear infections or hearing loss?
Nope.
Drainage or itchiness that you see, any redness or anything? And you hear okay, you don't have any issues with that. Perfect. I'm going to take a look at your ears. Go ahead and turn your head that way. I'm going to look at your external canal and behind your ear. I don't see any redness or drainage or anything, palpate any pain or
Nope.
discomfort with that. Go ahead and turn your head towards me, look at your external canal and behind your ear, and I'm not concerned any pain or discomfort. Perfect. And then with cranial nerve 8, I'm not concerned with your hearing just because you're answering all of my questions and my demands, so I'm not concerned. Do you
Okay.
feel like that you're having any issues with hearing? Okay. So I checked cranial nerve 1 with the smell. You got that correct. I checked cranial nerve 2. But again, since you get your eyes checked, I'm not concerned. We won't need to bring out the Snellen chart. For your eyes, I checked cranial nerves 3, 4, and 6. I checked cranial nerve 5 and 7. I checked a little bit of 8, but we'll do the rest at the end with your coordination and balance. I checked cranial nerves 9, 10, and 12. And I checked 11. I did your shoulder, so I'm not concerned with that. Go ahead and lift up your neck. I'm going to feel for your carotid artery. Go ahead and face that way for me with one hand. Perfect. I got a strong pulse. I'm just going to listen with my bell and to see if I can hear any breeze. Go ahead and hold your breath. Perfect. No breeze noted. Go ahead and face this way. One hand. Perfect. Strong pulse. Go ahead and hold your breath with one hand. Perfect. No breeze noted. So I'm not concerned there. I'm going to check your sinuses. Check your frontal. Any pain or discomfort?
No.
Axillary. Any pain or discomfort? No. Perfect. So I checked your head, your eyes, cranial nerves, lymph nodes, nose, mouth, cheeks, facial expressions, ears, neck. Checked your arms. All right, I think I'm ready for you to turn around, and I'm going to listen to your lungs. So I'll have you come up here. I'm going to take a peek at my sheet first, just to make sure. Okay, perfect. So I'm going to come around. I'm going to put my hands around your neck, but I promise I'm not going to choke you.
Okay.
I'm going to feel for your Adam's apple, which is about right here. I'm going to go to the side and I'm going to feel for your thyroid and I'm going to displace it. Before I do that, do you have any thyroid issues or history of thyroid issues with you or your family?
No.
Perfect. All right, I'm going to displace it and just feel for any enlargement, any issues or pain as I do that.
No.
Perfect. And like I said earlier, your trachea is in line. I don't feel any enlargement with your thyroid and you have no issues with that, so I'm not concerned. I'm gonna now just inspect your neck and your back. Can I undo your gown?
Yes.
Perfect. Okay. Your spine is in line, so I'm not concerned. I see a little bit of freckles and a little acne, but that's normal for you?
Yeah.
Okay, I'm gonna come down and check your lung expansion. I'm gonna find the base of your lungs or your ribs here. Perfect. I want you to take just a big deep breath for me. Perfect. I check your chest expansion. Both of your lungs are symmetrical, so I'm not concerned there. I now need to listen to 12 spots on your back for your lung sounds. Are you okay that I do that?
Yeah.
Go ahead and bring your shoulder blades back for me. Your shoulder blades, scapulas are here, and your spine is right here. I'm going to follow this like a C. I'll be listening again. You can go ahead and relax. I'm going to listen to 12 spots. Please raise your hand at any point if you need a break.
Okay.
And I'll check halfway through as well. Make sure you're good, okay?
Okay.
Be listening with my diaphragm. All right, go ahead. All right, we are halfway through. Are you feeling okay?
Yeah.
Okay. All right, perfect. I listened to all 12 spots and I heard clear lung sound, so I'm not concerned. I'm now going to percuss and I should hear resonance in them same spots that I listened to. I'm going to percuss, so just feel a little bit of tapping, okay? If you feel any pain or discomfort, just let me know. All right, any pain or discomfort with that? Perfect. And I heard resonance, which is normal and I'm not concerned there. Again, I checked your line, your spine alignment, your chest expansion. I listened to 12 spots in your lungs and I percussed, so I'm not concerned, okay? Go ahead and lay down for me. I'm gonna check jugular vein distension. I will have to take your pillow for a second. Go ahead and turn that way. Perfect. I don't see any jugular vein distension. Turn your head my way. No pain, or I'm sorry, no jugular vein distension noted as either of that. Okay. All right, now I'm gonna move down to your chest. Are you okay that I expose your chest? Perfect. Again, no heart issues with you.
Correct.
But you have a history of AFib in your family and hypertension.
Yeah.
Okay, but you get that checked regularly.
Yeah.
Okay, so I'm not concerned. I'm gonna inspect your chest. I see a little bit of redness, but nothing too concerning. It doesn't look like a rash or anything.
I'm not worried about it.
Okay, and I see some freckles as well, and that's normal for you?
Yeah.
Perfect. I'm going to listen to your 5 heart valves. I'm going to listen to your aortic, your pulmonic, Erb's point, tricuspid, and your mitral midclavicular, okay? I'll be listening with my diaphragm and my bell. First, I'm going to feel for your clavicle. I feel a space. I'm going to feel for your first rib here, your first intercostal, second rib, second intercostal space. So your aortic valve is right here. Again, I'll be listening with my bell. Or I'm sorry, my diaphragm first. S1 and S2 noted. And I'm going to flip over to my bell and listen for a heart murmur. No heart murmur noted. This is my patient's right side. This is my patient's left side. I'm not going to go to the left side. Feel for the clavicle space. First rib, first intercostal space, second rib, second intercostal space. So right here is your pulmonic. Can you bring the camera a little bit right here? Okay, perfect. Be listening with my diaphragm. S1 and S2 noted. I'm now going to flip over to my bell. Perfect. No heart murmurs noted. Okay, so this is the second intercostal space. So that's pulmonic valve. I'm now going to go to the third rib, third intercostal space right here. This is your Erb's point. Listening with my diaphragm. S1 and S2 noted. Now I'm going to listen with my bell. Okay, no murmurs noted. I'm now going to go to the fourth rib and then fourth intercostal space. So I'm going to go under here. Okay, and this is your tricuspid valve. I'm going to be listening with my diaphragm. Perfect. I hear S1 and S2. I'm going to flip over to my bell. No heart murmurs noted. And then I'm going to go down to the fifth rib, fifth intercostal space, and then I'm going to come over here about mid-clavicular, and then I'll be listening with my diaphragm. S1, S2 noted. Now I'm going to go over to my bell. And no murmurs detected. So I'm going to go back to my diaphragm and listen for 1 full minute. Perfect. I got 82 beats per minute, which is within normal ranges, so I'm not concerned. Okay. All right. I'm going to cover you up for privacy, and then I'm going to go at the end of the bed, and I'm going to inspect your abdomen. How are your bowel movements?
Pretty regular.
Perfect. And then do you have any abdominal pain or discomfort?
No.
And have you had any abdominal surgeries?
No.
Any intolerances?
No. I mean, yes, sorry.
You're fine.
I'm lactose intolerant.
And you stay away from that diet?
Yeah.
Perfect. And what's the color of your bowel movements?
Brown.
Perfect. Anything that you feel I should know?
Yeah.
Okay. I'm going to go at the bottom of the bed. I'm just going to inspect, see if there's any distension or masses, and I don't see anything, so I'm not concerned there. Alrighty. Now I'm going to listen into all 4 quadrants, and I should hear 35 gurgles, okay? I'll be starting in your right lower quadrant. Again, this is my patient's right side. I'll be starting in the right lower quadrant beneath the belly button. Listening with my diaphragm. I heard 35 gurgles. Right upper quadrant. 3 to 5 gurgles. Left upper quadrant. 3 to 5 gurgles. And then left lower quadrant. 3 to 5 gurgles. Perfect. Now I'm going to listen to your arteries with my bell. I'm going to find your xiphoid process in your belly button, and I'm going to meet halfway in the middle. I'm just palpating lightly to hold my spot, listening with my bell. This is your aortic artery. No buries noted. I'm now going to go to your right renal, about right over here, above your belly button. No buries noted. And then I'm going to go to your left side, left renal. No buries noted. And then I'm going to go to your right iliac. No buries noted. And then I'm going to go to your right iliac. And no buries noted. So I'm not concerned there. Back of my diaphragm. All right, now I'm going to percuss in each quadrant and just make sure I hear timpani, okay? Perfect. I heard tympani, so I'm not concerned. I'm now going to listen or feel for your liver border, which is on your right side, and I should hear dullness. Perfect. So I heard the dullness about right here, so your liver border is right here underneath your rib there, okay? All right, so I auscultated both quadrants and arteries, and then I percussed and liver border, and now I'm going to palpate. All right. I'm going to start with light palpation in your right lower quadrant. Let me know if you have pain or discomfort. No pain or discomfort. No pain or discomfort. Perfect. I checked all of the 4 quadrants, starting in a circle. Now I'm going to go deep palpation. Perfect. All right, I'm done with your abdomen. Are you okay that I check your femoral artery? I do have to access underneath your pants. Is that okay?
Yeah.
All right, I'll start on your right side here. I'll put this on first. It's a little easier. I'll be listening with the bell. I'm just going to go inside here at the crease of your leg. Go ahead and lift your leg up for me. Perfect. Go ahead and relax. I'm feeling right here, and I feel a strong pulse. I'm now going to go in and listen with my buoy. All right, I am feeling or listening right here. Perfect, no buoys noted. I'm now going to go on your left side. Go ahead and bring your leg up for me. Perfect, go ahead and relax. I'm feeling right here, and I feel a strong pulse. I'm now going to feel or listen with my bell. Same spot, so I'm listening right here. And no brace noted. All right, now I'm going to feel on both sides and just make sure that they are strong and symmetrical, okay? All right, so I'm feeling right here. Perfect. And they're strong and symmetrical, so I'm not concerned. Carve you up for a little bit of privacy. I'm now gonna move down to your legs. Do you have any tingling or numbness at all?
No.
Any issues with strength?
No.
Or anything with your legs? Okay. The collar looks good. I'll check your feet in a second. Are you okay to take your socks off? All right, I'm gonna check muscle tone and everything. I see some freckles, a little bit of redness, but is that normal for you?
Yeah.
Okay. All right, I'm going to squeeze for muscle tone. Perfect. I don't see any edema or pitting edema in either legs. Excuse me. Sorry. This is all normal for you, so I'm not concerned. Your color's good. I'm not going to feel for your remaining pulses. I'm going to feel for your popliteal pulse underneath your knees. Strong and symmetrical. I'm now going to feel for your posterior tibialis. Strong and symmetrical, and then your dorsalis pedis. Strong and symmetrical, perfect. And then I'm going to check your capillary filament and your toes. You have nail polish on, but I'll check the top parts of your foot. Perfect. And they both come back within 3 seconds on each foot, so I'm not concerned there. All right, I'm now going to check sensation in your legs. This is sharp, and then this is dull. I want you to close your eyes. Tell me if you feel dull or sharp and where, okay?
Okay. Dull right thigh. Dull left thigh. Sharp right shin. Dull left shin. Sharp top of the right foot. Dull top of the left foot. Dull bottom of the right foot. Dull bottom of the left foot. Sharp top of the left foot.
Okay. You did get 6 out of 8, but I went back and checked that one foot, so I'm not concerned. You seem to be feeling okay in your legs,
Yeah.
all right? Okay, so I'm not concerned. I'm going to have you put your socks on and go ahead and sit up at the side of the bed. I'll tie this up for you. And then while you do that, I'm going to check my sheet, okay?
Okay.
And just please don't get up until I walk with you.
Okay.
Alrighty. Alright, have you broken any bones in your legs or
No.
anything, any injuries?
Nope.
Alright, I'm going to check your strength. Go ahead and lift up for me. And lift up. Perfect. Go ahead and yep, perfect. And then the other way. Perfect. I hear a little bit of cracking, but no pain or discomfort. Alright, I'm going to check your patellar reflex. Okay. Alrighty, perfect. Alright, I checked your nose to the pen light. I'm going to have you put your hands like this and do this and back and forth as fast as you can. Perfect. Go ahead and put your legs on your lap and turn and go like this. Perfect. Any issues with that? Perfect. And I have you push down on my feet or on my hands. Push up and push out and push in. Perfect. Any pain or discomfort with that? Have you fallen recently or in the past at all? Okay. Okay, I think we are ready to continue on this assessment. Is there anything that you feel that I should know before standing up and checking your homework test?
No.
Okay. All right, I'll have you put on your shoes real quick. All right, and then I'm going to have you stand whenever you are ready. Do you feel lightheaded or dizzy at all?
No.
Okay. I want you to go and put your feet shoulder width apart and your hands to your side, not touching your body. And go ahead and close your eyes. And we're going to stay here for about 10 seconds. Perfect. All right, I would say you have a negative Romberg test. I've seen a little bit of swelling, but nothing too concerning. Okay. You feel comfortable to walk?
Yes.
Okay. All right, we're just going to walk normal to over near the door.
Okay.
Perfect. Perfect, and then you'll turn towards me and we'll walk the other way. All right, and then we'll walk the other way, but heel to toe this time. Feeling okay?
Yeah.
Perfect. All right, then we'll go back the other way. All right, and then go ahead and have a seat. You feel all right?
Yes.
Perfect. Okay, so your walk was good. I'm not concerned with any balance issues or anything. Is there anything else that you have any questions about or any concerns or anything?
No.
Okay, and on a brain scale, I would give you 23 points. I checked your sensation, your moisture, your mobility, your diet, your activity, friction, shear. One more time, sensation, moisture, mobility, activity, diet, friction, shear. And I have no concerns with any pressure injuries or anything like that. So I think we're good to go. I'm going to check my sheet one more time, make sure I didn't miss anything, and then we'll be done with our assessment, okay?
Okay.
Okay, that sums up our assessment.